It is the transformation of our health sector that is probably the most phenomenal testimonies of how we transformed COVID obstacles into opportunities that expanded our health facilities. In Nairobi alone, we have constructed over the period and operationalized 15 level 2 and 3 hospitals in various informal settlements through the Nairobi Metropolitan Service, and there are another 15 currently under construction. One of the unintended benefits of the pandemic is that we have increased, as a country, our ICU capacity by an impressive 502%, from 180 to 651 ICU-ready beds across the country. And similarly, our total hospital bed capacity as a country has increased by 47%, from 56,069 in the year 2013 to the current figure of 82,291 hospital beds spread throughout the country. During the COVID-19 pandemic, we have improved our oxygen generation capacity in all our public health facilities, from 3 million liters per day in March of 2020 to 32 million liters per day in October of 2021. We have further increased the number of reference laboratories that can test for notifiable diseases of international concern and public health importance, from one single laboratory in March of 2020 at the beginning of the pandemic to what we have today, which stands at 95. Fellow Kenyans, I just wish to remind you that at the beginning of the pandemic last year, we used to ship our samples for testing in South Africa, and the result turnaround time would be anything up to 5 days onwards. Today, we have our own capacity. These strategic diagnostic investments have strengthened the country's healthcare system, especially in response to the COVID-19 pandemic, and will propel us faster towards the attainment of universal health coverage and fortify our country's preparedness for future global health security challenges. The health workforce is a key pillar of every healthcare system, yet many times it turns out to be the weakest link, typically seen as a cost driver instead of an area for public and private investment in health service provision. In a bid to bridge the gap in human resources for health, the government has progressively recruited an additional 36,900 healthcare workers in the last 9 years, bringing total public health workforce to what it is today, 75,000 health workers. The mid-level healthcare worker plays a critical part and role in the health service delivery throughout all levels of care, specifically at the primary care level. And to this extent, we have expanded the capacity of our medical training colleges to train this critical mass of health experts from 28 KMTC campuses in 2013 to the current 71 campuses spread across 44 of our 47 counties. My administration has also put in place a comprehensive nationwide program to upgrade selected hospitals in all the 47 counties through provision of specialized, modern, state-of-the-art medical, diagnostic, and critical care equipment. Through the Managed Equipment Services project, whose objective was to improve access to quality specialized healthcare services throughout our country. Under this project, we have identified and equipped 115 hospitals with various theater equipment, 101 hospitals with various radiological and imaging equipment, 14 facilities with ICU equipment, and 54 facilities installed and commissioned renal equipment for dialysis. Through this massive investment, 628,000 people have benefited from theater services. 587,000 people have benefited from dialysis out of the 577 dialysis machines installed, and 23,574 people have benefited from ICU services, and over 5.7 million Kenyans have been served using the 22 MRI machines, the 214 X-ray machines, the 83 CT scanners, and the 229 ultrasound equipment that we have installed in various hospitals. All these some investments have so far benefited over 6 million patients and saved our country an equivalent of 131 billion shillings. Ladies and gentlemen, just the other day, I opened the Integrated Molecular Imaging Center at Kenyatta University Hospital. This is not just a first for Kenya, but for our entire sub-region. As a result, many of our citizens suffering from cancer will now have the benefit of early detection, leading to early treatment and cure, thus saving many lives. This, in addition to the millions of shillings that families who would have been forced to travel abroad seeking treatment for their loved ones will now save.